All right, good morning, Senate Health and Welfare, and it is May 26th. Thank you. So Jen, we're sort of crunched for time. You got 3 or 4 minutes, so maybe help us understand if there are any significant differences between what we passed for 197 and what the House has returned with us.
Okay. Jen Carvey, Office of Legislative Counsel. I have provided a markup version showing you for S197 an act relating to payment reform, or is it the new title of the end of the bill, reform for primary care. And this is showing the markup from the House proposal of amendment. So I would say probably the biggest change from what you sent over is this is not focusing on necessarily on using the Blueprint for Health as the basis for doing primary care payment reform. It is instead, it is expanding on Blueprint language the way you had, but it's not having necessarily setting that as the mechanism for getting larger payments for routine care out to the primary care practice. So it says it is the intent of the General Assembly to invest in primary care and to establish a program of universal primary care that is accessible and affordable for all Vermonters and will promote the public good through improving patient experience of care, improving population health, reducing costs, and improving provider well-being. And it gives the purposes of the bill: obtaining information needed to develop a framework for implementing universal primary care, optimizing the blueprint, determining whether the blueprint is an appropriate mechanism through which to provide universal primary care, and exploring other approaches and whether they may be more suitable than the blueprint. Then it makes the same changes that you had made in the blueprint language itself, except they strike out this new section that was being added, new statutory section that was being added on primary care spending targets, although much of this concept gets added in a different section.
So the per person per month is somewhere else.
Well, the idea of establishing a target for the amount of per person per month spending that should be on primary care and a transitional schedule to increase it over time, that goes somewhere else in the bill.
Okay.
But the increased spending directed to the per person per month payments in the blueprint is not, that's the piece that's coming out. So it's not, again, it's not necessarily choosing the blueprint as the basis.
Yeah.
You had a lot of reports that were due on January 1st. They were changed for the most part to January 15th. And again, backing off a little bit more circumspect about changes that would be necessary, but not necessarily are necessary. We're not sure if we're transitioning the blueprint payments. And then this is the report due from the blueprint. So the director of the blueprint by January of next year. And you sent over a list of things to go in that report. The House has added, starting with establishing definitions of primary care services and primary care provider, which is often a big part of the work in getting started on primary care reform. And they've left the rest of your provisions, made a couple of changes around the operational plan language you sent, had them providing a description of any operational additional legislation needed to implement the methodology not later than January 1st, 2028. They've taken out that date certain and instead asked for a proposed timeline for implementation. And then they've added a new provision asking the blueprint director to provide a description of the ways the blueprint can optimize services it's already providing for its current initiatives, what it would cost with doing that kind of optimization, and what additional per member per month spending would be needed. And that requires the director of the blueprint or designee to be available to the Health Reform Oversight Committee throughout the summer and fall for updates. Section 3A directs the Agency of Human Services in consultation with the Tax Department to recommend to various committees, including this one, a process by which blueprint funding could be transitioned away from the current process and toward using the healthcare claims tax, which was a recommendation from a blueprint report submitted in 2024 in accordance with Act 51 of 2023. So that's due by January 15th. what it would look like, what kinds of changes would there need to be to the tax rates, and what would be a potential timeline for implementation. Primary care spending report, just change the reference to the definitions to be the ones established in section 3. Section 5, this is where the primary care spending target language landed, directing AHS to establish a target for the amount per person per month spending should be on primary care in a transitional schedule. And then the potential for payer specific differences. So all of those concepts are still in here, just in a different format. Section 6. Don't too much. Section 6.
So here's what I'm going to suggest, Jen. We'll meet briefly, 15 minutes after the 4th. We're probably going to finish around 12.
And I have a committee of conference at 12, so you all can vote.
What time do you have it? At 12? Yeah,
And I
okay.
have to get up there to get the logistics for
So,
moving health,
okay.
education bills around.
Yeah, I will say, having looked at this with Jen on Friday, having reviewed it again over the weekend, I think that the changes are not significant.
Oh, I got it.
And really, I think,
You want me to give you the high level version of what else is
yeah,
in or not in? All right, section 6 directs the Agency of Human Services, Green Mountain Care Board, and Department of Financial Regulation in collaboration with the healthcare advocate to look at their roles in healthcare regulation and healthcare reform and make recommendations for where all of those functions should, in their minds, be housed, and come back with a report, separate reports from each of them in January with their own recommendations of how to distribute those responsibilities, where there's agreement and disagreement, and any legislative changes needed. And again, they would need to be available to the Health Reform Oversight Committee over the summer and fall. Section 6, you had them update the Green Mountain Care Board updating some reports. Green Mountain Care Board said they would need an appropriation to do that, and so the House took that language out.
because we don't have any money.
No changes on 7 or 8. Section 9 is a provision that is in the budget. And this is removing the sunset on the primary care medical student scholarship program. So it's not gone. It's just in the budget instead of in this bill.
Hmm.
And that's it. They've entitled it Inactivating to Reform for Memory.
Okay. Okay. Anybody want to meet again to discuss this?
Basically, it's moving out of the blueprint, a lot of it.
Right. It's taking a step back from deciding that blueprint should be the basis.
Right.
Makes it more generally primary care. Okay, straw vote. Good, thank you.
Yeah.
Perfect.
Thanks.
Majority of the committee.
You got that line down.
Got it.
Right.
Thank you, Jen. And no one. else. So we won't meet.
We won't meet.